Hello everyone, I am giving few images of a 40-year-old female undergoing ultrasound abdomen with non-specific upper abdominal pain which has been there for many months due to bloating after food intake. I am giving many 2D images and few with color Doppler. Please go through all the images, think about the findings and tell me what is this, and you have to tell me why and what to do in such a situation. If you want more time, please pause the video and reassess. Now we can go for the discussion. Are you ready? Let's go. All the 2D and color Doppler images are seeing total duplication of the involved segments everywhere, not only in the 2D images but also in the color Doppler images. This has been given as quiz through Google form, and many of them have given them as duplication artifacts or double image artifacts or mirror image artifacts, or one or two saying as side lobe artifacts or refraction artifacts. All these might be correct if it is seen only in one area, either in epigastric region or in hypochondriac region, but here it has been seen everywhere. I've gone through some of the articles having such incidents. Many articles are talking about the common artifacts, just beam width artifact, mirror image artifact or double image artifacts, which sometimes might be misleading the diagnosis. To the top, one of the articles was there even in transvaginal study due to the mirror image artifact in early intrauterine pregnancy. It had been interpreted as ectopic pregnancy with one intrauterine pregnancy. But in our quiz, the mirror image or double images or duplication artifacts are seen everywhere. So I concluded that these are not those artifacts. Now I will tell you the real scenario. What happened, I'll tell you. After finishing the morning session, I went for lunch. And at that time, echo would be done by our cardiologist. So after half an hour, I came back to see the remaining 3 patients to do ultrasound abdomen. First patient was done and you are seeing those patients' images. Same thing happened with the other 2 patients, all of them having duplication or mirror images, which you might be calling as everywhere. I knew all these are artifactual, but these are not the usual artifacts mentioned in our books or in the literature. In such incidents, I think many people might do this way. I think even in computers or with smartphones, it's being done routinely. I think everybody will do that. And the same way I did is nothing. Switching it off and again switched on. Usually many might get resolved, but in our mission nothing happened. Rescan was done to all of them and the same artifacts could be seen on all these 3 patients. Somehow one of the patients was lean enough, so I did with transvaginal probe to assess the abdomen. Here there were no artifacts through the transvaginal probe, so it is only with that curvilinear probe. Then I informed the application specialist that the probe is malfunctioning. He told that he would come next day morning. So after that, what I did the scan to see my own abdomen and all the artifacts were still persistent. Next day morning, one of my assistants gave the hint. Because of the fear factor yesterday, she didn't do that. Next day morning, she gave the hint, and after that, everything got resolved. What is that? So after that, I inquired with the application specialist, and how could that happen? And he verified with the senior director and conveyed that such had happened 3 times in our city and in the same type of missions with the same probe. So what is that? Finally, now I'll tell you how it got resolved in few seconds. Our machine has 5 probes, but only 4 can be connected. So I always ask our assistant to remove the linear probe while connecting the sector probe, because the linear probe is being less used in our center. But yesterday, the new ultrasound assistant, unaware of my order, she had removed the curvilinear probe and connected the sector probe. And after finishing the echo, she again reinserted the curvilinear probe, and after that these artifacts were there. So after listening all these things, so what I did, I removed the curvilinear probe and then reconnected it. Wow, all the artifacts are gone. I don't know how this can happen. Never heard of such problem in my lifetime, and this has not been documented in our literature, or I am not aware of it. Finally, I am concluding that as equipment generated artifact, which is one of the common artifacts encountered at least once in a year for everybody. But this has been encountered by me only recently. Okay, it's okay. So that's the end of the session. Please share this trouble to your colleagues who might be radiologist or sonologist or fetal specialist, and even they may be application specialists or sono engineers. If anybody has undergone such incident, please give your opinion in the comment section. Thanks a lot for taking your time. Bye bye. Take care.